Hi, I'm Hannah Seo, Assistant Editor of the Agents of Change and Environmental Justice Program. This is our first Science Snippets with the Agents of Change Fellows, where we talk to fellows about their new research.
Hi, my name is Daniel Carrión. I am a fellow for the Agents of Change. I'm also a postdoctoral fellow at the Icahn School of Medicine at Mount Sinai in New York City. So we wrote a paper titled Neighborhood Level Disparities and Subway Utilization During the COVID-19 Pandemic in New York City in Nature Communications. So the inspiration of this study is that early on in the pandemic, there was a lot of conversation about COVID-19 disparities experienced by Black and Latinx people. But there wasn't a lot of conversation about why there were so many disparities in terms of actual disease incidence, right? So a lot of the emphasis was thinking about how there were higher levels of pre-existing conditions in communities of color, and that might explain why there were higher amounts of severe disease. But that doesn't explain why these communities were being infected in higher rates in the first place. So we set out to understand maybe some of the social factors that informed differences in disease, in infections in the first wave of the pandemic. So what we did is we accessed census and New York City open data to try and understand some of the social factors that might inform disease incidence in different communities. And collectively, these social factors, we refer to them as neighborhood disadvantage. And we found that higher amounts of neighborhood disadvantage collectively were associated with higher rates of infections. We then took this measure of disadvantage that was associated with the infections and termed that our COVID-19 inequity index. We then used that index to look at subway ridership in New York City, which for us was a proxy for the capacity to socially distance. There were researchers who were essentially saying that different communities can't necessarily observe the stay-at-home orders equally than other communities, perhaps. And so we took that inequity index and we found that neighborhoods of higher disadvantage or higher on our inequity index also had higher ridership of the New York City subways, which to us pointed to the idea that perhaps these communities were less able to socially isolate or socially distance. We think that this work is important on a couple of levels. First is that we hope that there aren't future pandemics, but nonetheless, we need to prepare for the possibility of novel infections in the future and potential pandemics. And if one of our only ways of addressing these pandemics are things like stay-at-home orders, and we know that those stay-at-home orders aren't equally observable by communities, then we need to think about more tailored public health responses to these types of pandemics to try and take care of different communities. On another level, we think that this work is important because one of the things that we did in our study is that we actually explicitly excluded race and ethnicity from our explanatory social variables. But when we had this COVID-19 inequity index, we looked backwards and said, which communities have higher levels of this inequity index? And we found that indeed, Black followed by Hispanic and Latinx communities had higher levels of these COVID-19 inequity indices. And to us, that points to residential segregation and structural racism as being upstream determinants of these differences. And so that then points to the importance of social and labor policy in trying to mitigate these disparities in the long run and work towards health equity.